Hello, I'm back on YouTube, and I have an exciting update. I can finally say goodbye to these. Baby is 8 months, which means I am 8 months postpartum, and I have been wanting to get my laser eye surgery during mat leave, and tomorrow's the day. So when I first consulted, I found out that since I just gave birth, I had to wait at least 6 months postpartum to have my surgery. And then a few things to consider being a mom and a new mom is whether I was still breastfeeding. So as it turned out, at around 6 months, my breast milk just stopped. So that's another story for another video. Let me know if you want to hear about that. But yeah, so then I was able to get a surgery date for around my 8 months postpartum, which I just hit, and it is going to be tomorrow. With how the surgery goes, there is some preparation that needs to happen, which included not being able to wear contact lenses. And I really wanted to wear contact lenses to my best friend's wedding, which was sometime in June. And with the timing of everything, I'm just looking for the office staff who helped me coordinate all of my schedule. And so tomorrow was just the perfect day, which aligned with all of the timeline. But yeah. So I got a whole package of information that they told me I should read before the surgery, since I won't be able to see properly after the surgery. And I got all the prescriptions that I needed. Thankfully, I was able to get it at my local pharmacy all today. I was so worried because I realized oh my gosh, yesterday was Canada Day, which meant that I couldn't get it yesterday. And then I had my pre-op appointment, which gave me the list of medications to get on the 30th of June. So something that maybe you want to consider when you schedule is just what are the statutory holidays. But it worked out, thankfully. And I was given a coupon for one of the medications for I think half off, but turned out that my insurance actually covered it 100%. So also very grateful for insurance. And I also got a common question about cost and insurance regarding laser eye surgery. And for myself, it was $4,300. And that's for both eyes. And what I was told is that the cost depends on a lot of different factors. What kind of surgery are you getting? Also, what is your prescription? And I think the higher the prescription, maybe the cost is more. But yeah, thankfully I do have insurance. My husband also has insurance I'm able to also use. So it'll cover a big portion. I'm not sure how big, but at least a bit of the cost will be covered. And with this office, or with this surgery place, I have to pay upfront first, and then I can claim with my insurance afterwards. So a bit of a lessons learned on my side is prepare your payment method, and check with your bank institution, making sure you can get that money out, however you want to pay it, because I'm not quite sure if I did that properly, but we'll find out tomorrow. But yeah, lessons learned on my end. So I'm gonna read now what the preparation is. Ooh. Okay, so there's going to be 5 to 6 post-op visits with my co-managing eye doctor within the first year after the procedure. It will have some dry eyes, which will become worse for the first several months following the procedure. You may need to use artificial tears long term. And I understand that I cannot drive until my vision has reached at least 20/40 in one eye. So that's what I was told, is that in the recovery process, because it does take time for the cornea to heal after the laser, I might not be able to drive because I can't see completely clearly yet. And it ranges from anywhere from 1 to 3 or 4 months, depending again on how high your prescription is, and everyone's recovery process is different. So I don't know. And they always tell me like this is not going to help with like reading glasses in the future. I might still need that. It's only going to correct myopia, hyperopia, and or astigmatism. So if I do need reading glasses in the future, it's inevitable. And yeah, so this one I have to sign. So I'm going to do that tonight before I bring it in tomorrow. So some post-operative frequently asked questions from this place. It says, when do I have to wear the sunglasses? Oh yes, so I'm going to be given these really big clunky sunglasses apparently that I have to wear whenever I'm outside, even if it's like overcast, because any like bit of light will be very sensitive on my eyes. I have a friend who did this procedure, and apparently she said like for a good few months it was really hard to even like open her eyes. Or maybe she didn't say a few months. I think she said like the first week or so. Actually, I can't remember. I hope it wasn't a few months, because that sounds really debilitating, and she really did use that word, debilitating. So that's also why I coordinated with my husband. He's going to take the first week off after my surgery to take care of baby. I also have my in-laws who will help us care for her when my husband goes picks me up from surgery tomorrow. So I'm really grateful for the help that I have. And then I also was told to like get swimming goggles, so then when I shower, I can make sure that the water doesn't go into my eyes, because that's really important to not have like any water go in my eyes. And I also have like these safety glasses that will prevent baby from like scratching my cornea, because I got recommended that by the staff today that told me apparently a mom patient unfortunately got her cornea scratched, and yeah, it was a really terrible situation to be in, and I really hope I can prevent that. But yeah, this FAQ seems to be really helpful. I don't know, maybe we can go through it and then I can say like what aligned with it and what maybe I found different about it in a future video. And then I got like post-op checklist, and oh yeah, okay, day 1 post-op checklist. Oh no, this is day 1 to 7. This is like the first week. This is really helpful. I really like when they're so like organized like this. I'm definitely somebody who needs to be able to like keep track of everything that's going on. It has a bunch of instructions. Yeah. So what surgery did I decide to go with? I decided to do smart surface laser procedure, also known as SLP. And what's different about this versus LASIK, which I think maybe more people have heard of, is that LASIK actually does cut, and it opens the flap, and then it puts the flap back on, like your cornea, like the top of your eye. Whereas smart surface laser procedure, it doesn't actually cut into the cornea at all. It just lasers it right on top. So what I've learned is that in terms of the post-recovery process, LASIK is shorter of a recovery, and smart surface is a longer recovery because it takes a bit longer for the cornea to like, I guess, heal itself and then like grow back a bit, or heal. Yeah. So yeah, I was given some pain medications in case I need that to be able to fall asleep. And I have been taking a lot of different supplements to promote the eye health and the healing of the eyes post-surgery. So that was like omega-3, B12, and something else I'm forgetting right now. I think vitamin D as well. Oh yeah, right here. Omega fish oil, vitamin D, and vitamin B12. Yeah. And then, yeah, we'll see how it goes. We are on our way. Alright. In half an hour is my appointment. A bit more than half an hour. Should be able to get there right on time. Yeah. Saying goodbye to these glasses. Good thing it's not super sunny today. It's more of an overcast day. But I know that regardless if there's actual sun or not, it's still, no, it's the brightness. So like my eyes will still be quite sensitive. So got a cap. So hopefully that'll help as well. Baby's also super excited. Yeah.
You're excited mommy doesn't have any more glasses for you to pull off? Yeah. Yeah. Alright. One last look at myself with glasses, and then check back and surgery is done.
This is me. Everything's blurry right now. They said that's normal. Apparently day 3 and 4 is the worst. It's like peaking at day 3 and 4 for blurriness and discomfort. But yeah, apparently I just need to wear these for one night since I don't have a habit of rubbing my eyes. So I'm gonna wear these to sleep tonight. Don't I look super futuristic? Hi, hubby picked me up. And this is the first time I'm looking outside, and I can now see what my friend was saying, because she had gotten her laser eye surgery done, and she was saying it was quite hard to like look outside even though I have sunglasses, and this is overcast. It's like really hard to open my eyes, so I'm glad I have this cap. This cap really helps, and I'm kind of like looking down more than like looking out of the car windows. And yeah, we're just gonna go back. I miss my baby. I'm glad that so far she's been doing well with her grandparents. Yeah, we have like the little camera on so we can just kind of see how she's doing. But I have one prescription because of this cold sore. They just want to be extra careful that any bacteria of this cold sore won't, affect the healing. So I'm gonna get a prescription for my cold sore as well. Yeah, so one effect of this surgery that I wasn't told was that there's this weird taste in my mouth. Like, to me, it was actually quite nauseating. Apparently it's from like the eye drops that they give, maybe like the numbing eye drops like before the laser. It could be any of those drops, and I still feel that taste in my mouth. So drinking water did help a bit, but it's still in my mouth, so maybe I'm gonna like have something sweet or something and then it should go away. But yeah, I thought I shared that because it just shows everybody's experience is a bit different. I mean, it's nothing that I wouldn't do again. I would say overall it was very comfortable of the procedure. I think it's mostly the recovery process that I'm gonna see how bad it really does get, because they say day 3 and 4 is the worst. The surgeon described it as like 2 tectonic plates that's merging together, and at day 3 and 4 is kind of when they merge, and then it's like Mount Everest is how he said it. So it's like healing, and then that's the day that will get more blurry. I'll get more uncomfortable. I'll probably need more lubricating drops, maybe close my eyes more, that kind of thing, stay inside. But yeah, it's good to prepare for it. And in terms of driving, they say that not until they clear me. So I have quite a few like post-op appointments with them that they'll just continue to check to make sure that the healing is going well. But yeah, grateful that we planned ahead. And in terms of taking care of baby, my husband will be helping with that. And then I don't really need to drive much the next 3 months. But yeah, hopefully I can actually drive sooner, because they say if everything heals up well, then I can actually drive sooner than like 1 month. But it really just depends patient by patient and how high your prescription is. So my prescription is about 3.5, and yeah, so that's not super low but not super high, so I'll see how my recovery goes. Alright, I'm back home. Everything's really blurry and I need to follow my instruction sheet. So upon arrival at home, I'm gonna take the preservative-free lubricating eye drop, and then there's a few medicated eye drops, and I like how they label it so that I know, like, I take A, and then I take C, and then I take, this one's called FML because it's short form for what this is, and it's like alphabetical order, so it's super easy for me to remember. So I'm gonna take this off. Yeah, everything's really blurry right now, but I'm not feeling any pain yet, which is good. I think the numbing eye drop is still helping. So I'm just gonna. Okay. So that's the preservative free, and then I'm going to do the A. And then it says to close my eyes for 1 minute. Oh, can't remember if I can screw this back on. Oh yeah, I can. Perfect. So then I can reuse that. 1 minute each drop with eyes closed. Oh, I'm getting a call. Hey Google. Oh. Hey Google. Timer for 1 minute.
All right, 1 minute. Starting now.
No, it's for a minute. Baby's with my mother-in-law right now. Good thing she's playing really well with her. Oh, my husband came home. That's good. My husband went to get one of my last prescriptions. That was for the cold sore. Yeah. It's done. A minute feels like a long time. Almost there. Oh, there we go. Now I can gently open my eyes. Stop. Oh, actually feels like it's a little bit clearer now. Okay, so I did A. Now I need to do C. C is this one. It said always shake these bottles. C. Hey Google, timer 1 minute.
Okay, 1 minute. Starting now.
That's C. Minute. And then FML after. But yeah, so far, oh, poor baby's crying. I'm trying my best not to go out there because I can't take care of baby this week. I'm just letting my family help. Hey Google, stop. Okay, now I can slowly open my eyes. All right, and the last one is the FML. Okay, let's open it. Like this. Oh, poor baby's crying. Go. Hey Google, timer for 1 minute.
All right, 1 minute. Starting now.
Yeah. So I'm thinking of listening to more podcasts, like using the audio Bible, and getting back into my devotionals. It's actually a really good time to just slow down and be on my social media less, which is why I really enjoy YouTube. I remember now why I did more YouTube videos. I felt like I was less doom scrolling, because although I will still be using Instagram and TikTok, because a lot of brands really want me to post on there, especially businesses, they really want to be on Instagram and TikTok. I know a lot of people are on there, and there's better traction, but it's a lot. And I've been reflecting, I've been doing content creation for 5 years now, and I feel like there needs to be a shift in how I create. Hey Google, stop. And yeah, so I think this is gonna be really good as I recover, just be off my phone more. Okay, and that's the first set. I don't think I'll be filming like every single time, but I thought I filmed the very first time I do this just to kind of see how it was for me. Again, for myself, I don't think it was that much work. I do understand that, there's a few things you have to remember to do during this whole recovery process, but as long as you just follow their really organized, laid out instructions, I think I'll be okay. I think I'll be okay too. All right, putting back the sunglasses. Just gotta keep wearing these. And then putting back all my drops. This one's really convenient that they have it all in a little baggie. I'm just gonna put it all in there. Don't lose anything. I'm gonna take the Sustain out though, because I probably will have this all over my home and in my bags as I go out. It's great that they provided a few of the bio tiers as well, so I can use that first. Oh, I'm like not in frame. All right, now it is pretty much evening. I took a nap, and yeah, everything's still a bit blurry, but I feel like it's kind of going in and out of clear and blurry, which was expected. One symptom that they told me I would expect to have is a bit of a stuffy nose and a bit like I'm feeling a bit sick. And they say that's also normal. That will also go away. And then I was given saline to drop along my lash line right before I open my eyes. And this just helps to open my eyes very, very slowly. They say I have to be very careful to not force my eyes open or anything like that. So that's definitely been helping. And I definitely think the Advil and Tylenol extra strength I've been taking is helping with any discomfort and pain. So yeah, this is still day 0. Again, they said it isn't going to be until day 3 or 4 that the increase in discomfort and pain will happen. So everything is still quite manageable. Yeah, just a quick update on that.